So we are going to continue with our chapter on automated databases. Today I have not made the slide, so you need to listen to me and take down the important points. Okay, I am audible clearly. Can somebody respond?
Yes, sir.
Yeah.
Yes, sir.
So the next database which we are going to understand is medical record database. This is the third type of database which we have understood earlier, medical record database. Now, how does it work? Usually such database is used in the hospital. Okay. So we know clearly that outpatients visit hospital. Later they will be admitted to hospital as inpatients. So both outpatients as well as inpatients who visit the hospital will give the information about the signs and symptoms, right? Signs and symptoms. They report, they complain their medical problem, which are called as symptoms, and signs will be identified by physician. Now, the clinical information, signs, symptoms, as well as the laboratory data are recorded in a database known as primary medical record. The clinical information is recorded in a database known as primary medical record. Irene Sara, can you mute your audio? So they use this medical record as a base to treat the patient, So such a recording is dependent on the preset signs and symptoms. For each diagnosis, there will be a signs and symptoms, standard signs and symptoms based on ICD-10 criteria or any other guidelines available for the diagnosis. And the signs and symptoms are recorded. Based on this medical record, the treatment is given. Now, the treatment which is given based on the primary medical record is considered as authentic or correct, right? So the treatment which is given to the patient will cost some amount of money for healthcare facilities or the healthcare providing. So such cost will be taken into the consideration for the reimbursement, right? So here there is no such thing that patient submitted bills and there is always a doubt that whether the doctor has done the assessment properly or not. No such ambiguity or confusion in medical record database. There are all the signs and symptoms will be documented as per the standard guidelines, and they are very much sure that treatment has to be started based on the guidelines, so they become standard. So such data is more authenticated. But this kind of the medical record database also has some problem. The problem is that, say for example, a patient who is uh, who is complaining for depression disorder will also get some kind of counseling which may be based on the family. So the counseling which is given for the patient due to his family problem will not be considered in the process of diagnosis of depression disorder. So such kind of piece of information or the service which is done will not be known through this database. So the amount of money which perhaps would have been charged for such service, small service, will go waste, will go unnoticed actually. So that is the limitation actually in this medical record database. Another important aspect is that the site of treatment is not mentioned sometimes. Say, for example, a patient who had an injury had come to the hospital and or maybe surgically operated patients would have come because of some problem. So they will be the patient will be saying that they have a body ache in other places also, in addition to the site of surgery. So what happens is that the treatment which perhaps been given to the other signs and symptoms will not be documented, in this medical record database, because such kind of clinical symptoms are dependent on the primary surgery which is done, or which is the main factor or main cause for the major pain. So such kind of details are not available. So that is why medical record database, even though it is standard, it has a limitation in the sense that the site of treatment given is not mentioned, and a piece of care, health care which is given is not mentioned. So that is only the disadvantage. These are only the disadvantages or limitations of this database. These databases are mainly used in United Kingdom. They're called as United Kingdom General Practice Research Database. And one more is the Health Improvement Network. I repeat, UK General Practice Research Database, the Health Improvement Network. So these are the databases that are used in the UK, United Kingdom, right? So that is about this medical record database. Whether anyone has any doubt in this regard? Anybody has any doubt? Can I move on?
Yes, sir.
Okay. Now we have understood what are automated database, what are the ideal characteristics, what are their advantages, what are the types of databases, how they work, what is their advantages and disadvantages. So having understood that specifically, now let us understand next advantages of computer databases or automated databases. Now you have listened to the various advantages and disadvantages. Can you able to say what could be the advantages from your side as per your thinking goes? Anju, Varki? Can you think what would be the advantages of this automated database? Anne Maria?
So we can get variety of clinical and demographic information of the patient.
Yes, correct. Variety of information from different types of patients, we can get the details. Very good. Next, any other advantage you can think of?
It will helpful in patient care purpose like quality of the treatment and all.
Yes, quality. It helps in the quality of the treatment as well as the reimbursement too. Right. Next advantage, can you think?
It satisfy the legal requirements for the reimbursement.
Yeah, correct. That's right. Yeah. Any other things?
No, sir.
Okay, good. Aparna?
So the data collected will be reliable.
Okay, good. Reliable.
And the data will be authentic and it cannot be manipulated in any way.
Yeah. Yeah, in one word you have mentioned reliable. That sounds perfect. Reliable. Yeah.
Yeah.
Any other advantage you can think of?
The
No problem. We will move on to Aquina.
So multiple types of data can be collected, can be stored.
Correct.
Then data can be we can collect data easily.
Correct. So there is no. Is
Then
there any
detailed information. Detailed information about the patient.
Yes. Correct. How many? Okay, we will move on to other person also. Giarly. Yeah. Any other advantage you can think of?
Information on drugs taking.
Drug treatment also can be obtained. Yeah, that's right. Any other things? Okay, we will move on to Irene.
Sir, improved quality and efficiency.
Yeah, correct. Yeah.
We can reduce error while the writing errors can be reduced.
Yes. Okay.
That's it, sir.
Okay.
The papers would reduce and all, we can reduce that.
Sorry?
The papers, all things we use for writing, we can avoid all those.
Yes. That's right. Yeah. Correct.
Those things can.
Okay. Okay, let us move on to other people also. Kamal. Kamal, any advantage you can think of? Kessia? Korean?
The data can be retrieved at any time required.
Yeah, correct. Then
Less expensive.
less expensive. Very good. Okay. Yeah. How many patients' data can be accommodated? How many patients' data can be accommodated?
More numbers.
Yes, more huge. Large number of sample size can be possible for the for conducting pharmacoepidemiological studies. Very good. Let us ask Kezia Rachel. Any other advantage, Kezia Rachel? Lakshmi?
Yes, sir.
Any other advantage you can think of?
So data sharing can be easy.
Data sharing can be easy. Okay. Any other things?
The errors of data can be reduced.
Sorry, can you please repeat?
Errors can be reduced.
Errors can be reduced. Yeah. So is there any bias recall bias, interviewer bias here?
Yeah,
There is a bias here.
I think.
You think so? Okay. We will ask Manoj. Manoj, whether there is any bias. Whether there is any bias.
Bias. I don't.
You don't know bias.
No.
What were you doing when we were discussing advantages and disadvantages of pharmacoepidemiological methods? We have studied so many bias now.
Advantages, I know, so like errors can be.
Disadvantage you did not read, huh? Okay. You think any other advantage?
Sir, it helps in administrative issues. It will assist us in administrative issues.
Yeah, that's right. Yeah.
Helps in better patient care.
Yeah. Can you link this database with other database?
No ideas.
Okay. Marlene, Sarah.
Sir,
Can you link this database with other databases?
don't know, sir.
Okay. Is there any bias in this while using this database?
Sir, less bias will be there, I think.
Less bias will be there. Yeah. So actually, there's no opportunity for recall bias. What we call it as recall bias or interviewer bias. Once you have entered the data, it will be perfect. It will be stored and retrieved at any given time reliably. So the chances of bias is not there, right? So that is the advantage. We will ask Navindran. Navindran, can you connect this database to other databases?
Sir,
Huh? Sorry?
I don't know, sir.
Don't know. Okay, okay. Nikita?
I don't know, sir.
I don't know. Okay. Ria Sara?
So it can be connected to administrative database.
Okay. Such as?
Like more the number of patients, more amount of data can be recorded, and it helps us in understanding how well the hospital is working out and providing better efficacy or treatment to the patients.
Now, my question to you was that whether one database can be connected to another database.
Yes, sir.
Such as? Can you give me an example?
It's a linkage system. The one you're talking.
Yeah, that's right. Now you're recalling the concepts. Correct. Now, what type of database, for example? Can you think of any database?
So the treatment, the adverse drug reactions, all that can be connected.
Yeah.
For surveys or.
Yeah. So the database can be connected to such as death records, maternal and child records, police accident records, or elderly record, then drug-induced problems records. So like that, it can be connected. So that is another advantage. So when you're trying to connect, you can try to find out that how many drugs are really causing the problem in the manner that the drug-induced problems or death caused problems or any other child issues or maternal or child issues, right? What are the disadvantages of this database sometimes? Let us ask SOURCES3 Lekha. What do you think?
Disadvantage. Sometimes data might lose, sir.
Data. Earlier you said that your friend say that it is reliable. Now you say that that may be lost. Which one I should take now? Your
No,
friend?
sir, data will be reliable only.
Data will be reliable only. Okay. So what can go wrong? Your answer is correct. The way you put is important. So your answer is probably in the right direction. You are not trying to say what you exactly wanted to say.
I don't know, sir, like how exactly to put.
Okay. Okay. Let us ask other people. Safisha?
Yes, sir.
Yeah. Tell me, can you think of disadvantage?
The validity of diagnosis data may be uncertain.
Why it is uncertain?
So, like,
Your answer is correct. Why? Just now we have understood, no? In medical database. Sometimes the piece of care which is given, site of treatment is not mentioned. At that time, validity becomes a kind of question sometimes. Correct. Right? You got it now?
yes.
Yeah.
Yes, sir.
Yeah. So let us understand other people also what they want to say. Shireen Babu?
Yes.
Yeah. Tell me.
Um, sir, some confounding factors information will not be there.
Yes,
Will not be
correct.
recorded, sir.
Correct. Some of the database such as claims database where confounding factors are not documented properly or confounding factors data may not be available there. Yeah. So Sonam?
Yes, sir.
Yeah. Any other doubt you can think? Any other disadvantage you can think of?
Sir, sometimes the patient might not tell their problems correctly.
Yeah.
So,
it becomes incomplete data. Correct?
yes, sir.
Yeah. Okay. Sherin Babu, any disadvantage you can think of?
No, sir.
Okay. Tenzin? Amal Jishnu?
Sir, it's complex and time consuming to design.
Complex and time consuming. And once you say that, you will get all the details and it can be retrieved very fast. On the other side, you say that it is time consuming, complex. Which one is right now? Why do you think that it is complex, Amal?
So it's difficult to design.
What difficulty you're expecting with the computer? You have to start the computer, then search the database, activate the database. Do you think that that is the difficult part?
So it's a hardware and software startup cost. Maybe.
Okay. So you mean you need a genius computer person who has to make supercomputer for you?
No, sir.
Then what is the complexity you're thinking of?
I don't know, sir.
Yeah, like complexity in the sense that some administrative database cannot give some data. Like for example, part-time working and a part-time study. You'll not be able to calculate actually the part-time in the studies of the disease incidence. Some people will be working, so it doesn't calculate actually administrative. How long those people were involved in the calculation of the disease incidence. So what happens is that that data will be missing actually. So that is the complexity which is associated with some of the databases as administrative database. So since it doesn't calculate some of the part-time working or part-time treatment, so what happens is that even healthcare reimbursement also will be very difficult to calculate. So as I say, the oral data sometimes we may not get it actually. So that is a way. In that way, it looks complex, right? Let us go to Anjuvarki again. Anjuvarki.
Yes, sir.
Any other disadvantage you can think of?
Sir, don't know, sir.
Okay, Aparna.
Sir, everyone will not be familiar with this type of database, so some initial training should be given.
We will give you the training. We will give you exclusive training for 10 days. We will make you master, then only we put it on the job.
That's it, sir. I don't know.
Okay, good try. Yeah. Aquina.
Sir, regarding data security.
Data security. No, we will give you password and all. No, earlier you said that these people, I mean, the computer should be password protected. Correct? You people only told no. No, why you yourself say that data will not be protected?
Sir, I don't know.
Okay. Yearly.
Yes, sir.
Any other things you can think of? Okay, I would like to give you a situation whether all the types of illnesses are recorded in the database yearly. All the type of diagnosis is mentioned, is recorded.
Yes, sir. I don't know.
Yes, sir. I don't know. Okay, which one I should accept now? Irene, Sarah.
Sir.
Whether all the types
Sir,
of illnesses can be documented.
I think so, sir.
You think so? Okay, Kamal. Kessia Korean.
Don't know, sir.
Kezia Rachel.
Yes, sir.
All the types.
Yes.
Okay, Lakshmi. What do you think?
Yes, sir.
What do you think?
I think all types can be recorded.
You, Manoj.
Don't know, sir.
Marlin, Sarah.
Don't know, sir.
Navindran. Navindran. Nikita.
Sir, I think so. All the type of.
You think so?
That,
All are needed.
yes, sir.
Okay, Ria, Sarah.
Yes, sir. All types of data can be recorded.
Sai Srileka.
Yes, sir. All type of data can be recorded.
Safisha.
So maybe all types of data can be recorded.
Okay, Sherin.
No, sir. Don't know idea, sir.
Okay. Sonam.
Sir, maybe they won't record some minor diseases.
Yes, correct. That's right. So only severe illnesses are recorded. Minor are mild, moderate, are not recorded because they can recover from them very fast or within a short period of time. So they don't go noticed. So only severe illnesses are recorded. So what happens in this situation? We may lose mild and moderate illnesses, which later can become severe illnesses. So that is always the possibility that. So this is another disadvantage, right? And the electronic health records cannot be linked to administrative databases. Administrative database cannot be linked to electronic health records. So these are the disadvantages of automated databases, right? So if you have any doubt, you can now ask. We have time. After this, it will be delinked, so you don't have to link back. Now still you have 3 minutes to ask any doubt. Usually these questions, what I used to understand is that they come as a long essay type or short essay type questions, where they ask exclusively on the automated database or maybe specific type of databases. In the like this is the one particular chapter of this main chapter. Would you like to go for a class test, in the next class for this, or would you like to go with another studies like what is known as ad hoc studies are there? So there are many things to subject there. Do you want the class test of this chapter tomorrow as a one chapter, like as one class test, or maybe you can take it in the form of class test 1 and 2. I'll leave it to Manoj. Manoj is there?
Yes, sir.
So be in touch with me. I'll pass on the notes to you. Just
Okay,
ask whether everybody is fine with the class test that completes this particular sub chapter, right?
Okay, sir.
Okay, you can get delinked. No problem.
Thank you, sir.
Thank you.